Hello everyone, welcome to our channel. In today's video, we'll practice important NCLEX-based multiple choice questions that will boost your confidence and sharpen your exam skills. Stay till the end to test your knowledge and learn key concepts you can't afford to miss. Let's get started with the first question. 1. A client receiving routine preoperative fluids had a 1000 milliliters bag of 5% dextrose in 0.9% sodium chloride hung at 1500. The nurse making rounds at 1545 finds that the client is complaining of a pounding headache and is dyspneic, experiencing chills, and apprehensive, with an increased pulse rate. The intravenous, 4, bag has 400 milliliters remain ing. The nurse would take which action first? 1. Slow the 4 infusion. 2. Sit the client up in bed. 3. Remove the 4 catheter. 4. Call the primary healthcare provider, PHCP. Answer: 1. Slow the 4 infusion. 1. Answer: 1. Rationale. The client's symptoms are compatible with circulatory overload. This may be verified by noting that 600 milliliters has infused in the course of 45 minutes. As there are no data in the question to indicate that the client is in shock, the first action of the nurse is to slow the infusion. Other actions may follow in rapid sequence. The nurse may elevate the head of the bed to aid the client's breathing, if necessary. The nurse also notifies the PHCP. The 4 catheter is not removed. It may be needed for the administration of medications to resolve the complication. 2. Packed red blood cells have been prescribed for a client with anemia who has a hemoglobin level of 6.8 g/dl, 68 g/l, and a hematocrit level of 28%, 0.28. The nurse takes the client's temperature before hanging the blood transfusion and records 100.6 degrees Fahrenheit 38.1 degrees Celsius orally. Which action would the nurse take? 1. Begin the transfusion as prescribed. 2. Administer an antihistamine and begin the transfusion. 3. Administer 2 tablets of acetaminophen and begin the transfusion. 4. Delay hanging the blood and notify the primary healthcare provider, PHCP. Answer: 4. Delay hanging the blood and notify the primary healthcare provider, PHCP. 2. Answer: 4. Rationale. If the client has a temperature higher than 100 degrees F, 37.8 degrees Celsius, the unit of blood would not be hung until the primary PHCP is notified and has the opportunity to give further prescriptions. The PHCP likely will prescribe that the blood be administered regardless of the temperature, or may instruct the nurse to administer prescribed acetaminophen and wait until the temperature has decreased before administration, but the decision is not within the nurse's scope of practice to make. The nurse needs a PHCP's prescription to administer medications to the client. 3. The nurse is caring for a client experiencing acute lower gastrointestinal bleeding. In developing the plan of care, which priority problem would the nurse assign to this client? 1. Low fluid volume because of acute blood loss. 2. Risk for aspiration because of acute bleeding in the GI tract. 3. Risk for infection because of the acute disease process and medications. 4. Weight loss because of a lack of nutrients and increased metabolism. Answer: 1. Low fluid volume because of acute blood loss. 3. Answer: 1. Rationale. The priority problem for the client with acute gastrointestinal bleeding among these options is low fluid volume because of acute blood loss. This state can result in decreased cardiac output and hypovolemic shock. Although nutrition is a problem and weight loss can result, low fluid volume is more of a priority. The client is at risk for aspiration and infection, but these are not actual problems at this point in time. 4. The nurse is assessing the functioning of a chest tube drainage system in a client with a chest injury who has just returned from the recovery room following a thoracotomy with wedge resection. Which are the expected assessment findings? Select all that apply. 1. Excessive bubbling in the water-sealed chamber. 2. Vigorous bubbling in the suction control chamber. 3. Drainage system maintained below the client's chest. 4.50 milliliters of drainage in the drainage collection chamber. 5. Occlusive dressing in place over the chest tube insertion site 6. Fluctuation of water in the tube in the water seal chamber during inhalation and exhalation. Answer: 3, 4, 5, 6. 4. Answer: 3, 4, 5, 6. Rationale. The bubbling of water in the water seal chamber indicates air drainage from the client and usually is seen when intrathoracic pressure is higher than atmospheric pressure. It may occur during exhalation, coughing, or sneezing. Excessive bubbling in the water seal chamber may indicate an air leak. An unexpected finding: fluctuation of water in the tube in the water seal chamber during inhalation and exhalation is expected. An absence of fluctuation may indicate that the chest tube is obstructed or that the lung has re-expanded and that no more air is leaking into the pleural space. Gentle, not vigorous, bubbling should be noted in the suction control chamber. A total of 50 milliliters of drainage is not excessive in a client returning to the nursing unit from the recovery room. Drainage that is more than 70 to 100 milliliters per hour is considered excessive and requires notification of the surgeon. The chest tube insertion site is covered with an occlusive, airtight dressing to prevent air from entering the pleural space. Positioning the drainage system below the client's chest allows gravity to drain the pleural space. 5. A client is brought to the emergency department with partial thickness burns to the face, neck, arms, and chest after trying to put out a car fire. The nurse needs to implement which nursing actions for this client? Select all that apply. 1. Restrict fluids. 2. Assess for airway patency. 3. Administer oxygen as prescribed. 4. Place a cooling blanket on the client. 5. Elevate extremities if no fractures are present. 6. Prepare to give oral pain medication as prescribed. Answer: 2, 3, 5. 5. Answer: 2, 3, 5. Rationale. The primary goal for a burn injury is to maintain a patent airway, administer intravenous, 4, fluids to prevent hypovolemic shock, and preserve vital organ functioning. Therefore, the priority actions are to assess for airway patency and maintain a patent airway. The nurse then prepares to administer oxygen. Oxygen is necessary to perfuse vital tissues and organs. And 4 line should be obtained and fluid resuscitation started. The extremities are elevated to assist in preventing shock and decrease fluid moving to the extremities, especially in the burn-injured upper extremities. The client is kept warm, because the loss of skin integrity causes heat loss. The client is placed on NPO, nothing by mouth, status because of the altered gastrointestinal function that occurs as a result of a burn injury. 6. A client is admitted to a hospital with a diagnosis of diabetic ketoacidosis, DKA. The initial blood glucose level is 950 mg per deciliter, 52.9 millimoles per liter. A continuous intravenous, 4, infusion of short-acting insulin is initiated, along with 4 rehydration with normal saline. The serum glucose level is now decreased to 240 mg per deciliter, 13.37 millimoles per liter. The nurse would prepare to administer which medication next? 1. An ampoule of 50% dextrose. 2. NPH insulin subcutaneously. 3. 4 fluids containing dextrose. 4. Phenytoin for the prevention of seizures. Answer: 3-4 fluids containing dextrose. 6. Answer: 3. Rationale. Emergency management of DKA focuses on correcting fluid and electrolyte imbalances and normalizing the serum glucose level. If the corrections occur too quickly, serious consequences, including hypoglycemia and cerebral edema, can occur. During management of DKA, when the blood glucose level falls to 250 to 300 mg per deciliter, 13.9 to 16.7 millimoles per liter, the 4 infusion rate is reduced and a dextrosolution is added to maintain a blood glucose level of about 250 mg per deciliter, 13.9 millimoles per liter, or until the client recovers from ketosis. 50% dextrose is used to treat hypoglycemia. NPH insulin is not used to treat DKA. Phenytoin is not a usual treat. MET measure for DKA. 7. The nurse is assessing a client with multiple trauma who is at risk for developing acute respiratory distress syndrome. The nurse would assess for which earliest sign of acute respiratory distress syndrome? 1. Bilateral wheezing. 2. Inspiratory crackles. 3. Intercostal retractions. 4. Increased respiratory rate. Answer: 4. Increased respiratory rate. 7. Answer: 4. Rationale. The earliest detectable sign of acute respiratory distress syndrome is an increased respiratory rate, which can begin from 1 to 96 hours after the initial insult to the body. This is followed by increasing dyspnea, air hunger, retraction of accessory muscles, and cyanosis. Breath sounds may be clear or consist of fine inspiratory crackles or diffuse coarse crackles. 8. The nurse is caring for a client with chronic kidney disease on continuous renal replacement therapy, CRRT, without the use of a hemodialysis machine. The nurse determines that which parameter is most important in ensuring success of this treatment. 1. Mean arterial pressure, MAP. 2. Systolic blood pressure, SBP. 3. Diastolic blood pressure, DBP. 4. Central venous pressure, CVP. Answer: 1. Mean arterial pressure, MAP. 8. Answer: 1. Rationale. Continuous renal replacement therapy, CRRT, provides continuous ultrafiltration of extracellular fluid and clearance of urinary toxins over a period of 8 to 24 hours. It is used primarily for clients with acute kidney injury, AKI, or critically ill clients with chronic kidney disease, CKD, who cannot tolerate hemodialysis. Water, electrolytes, and other solutes are removed as the client's blood passes through a hemofilter. If CRRT does not require a hemodialysis machine, the client's MAP needs to be maintained above 60 mm of mercury, and arterial and venous access sites are necessary. The SBP, DBP, and CVP may be monitored, but each of these measures a component of the cardiovascular status rather than the complete cardiac cycle. 9. The nurse is monitoring a client with a head injury for signs of increased intracranial pressure. The nurse would note which trend and vital signs if the intracranial pressure is rising. 1. Increasing temperature, increasing pulse, increasing respirations, decreasing blood pressure. 2. Increasing temperature, decreasing pulse, decreasing respirations, increasing blood pressure. 3. Decreasing temperature, decreasing pulse, increasing respirations, decreasing blood pressure. 4. Decreasing temperature, increasing pulse, decreasing respirations, increasing blood pressure. Answer: 2. Increasing temperature, decreasing pulse, decreasing respirations, increasing blood pressure. 9. Answer: 2. Rationale. A change in vital signs may be a late sign of increased intracranial pressure. Trends include increasing temperature and blood pressure and decreasing pulse and respirations. Respiratory irregularities also may occur. 10. A client develops an anaphylactic reaction after receiving morphine. The nurse would plan to institute which actions? Select all that apply. 1. Administer oxygen. 2. Quickly assess the client's respiratory status. 3. Document the event, interventions, and client's response. 4. Keep the client supine regardless of the blood pressure readings. 5. Leave the client briefly to contact a primary healthcare provider, PHCP. 6. Start an intravenous, 4. Infusion of D5W and administer a 500 ml bolus. Answer: 1, 2, 3. 10. Answer: 1, 2, 3. Rationale. An anaphylactic reaction requires immediate action, starting with quickly assessing the client's respiratory status. Although the PHCP and the rapid response team must be notified immediately, the nurse must stay with the client. Oxygen is administered and an 4 of normal saline is started and infused per PHCP prescription. Documentation of the event, actions taken, and client outcomes needs to be done. The head of the bed should be elevated if the client's blood pressure is normal. 11. A client in shock develops a central venous pressure, CVP, of 2 mm of mercury and mean arterial pressure, MAP, of 60 mm of mercury. Which prescribed intervention would the nurse implement first? 1. Increase the rate of O2 flow. 2. Obtain arterial blood gas results. 3. Insert an indwelling urinary catheter. 4. Increase the rate of intravenous, fluids. Answer: 4. Increase the rate of intravenous, fluids. 11. Answer: 4. Rationale: the MAP and CVP are both low for this client, indicating a shock state. Shock is the result of inadequate tissue perfusion. Fluid volume should be immediately restored first to provide adequate perfusion for the client in a shock state. Although increasing the rate of O2 flow may be a necessary intervention, perfusion is the first priority. Obtaining arterial blood gas results and inserting an indwelling urinary catheter may be necessary interventions to monitor the client's response to prescribed therapy, but these are not the priority. 12. A client at risk for shock secondary to pneumonia develops restlessness and is agitated and confused. Urinary output has decreased, and the blood pressure is 92/68 mm of mercury. The nurse suspects which stage of shock based on this data? 1. Stage 1. 2. Stage 2. 3. Stage 3. 4. Stage 4. Answer: 2. Stage 2. 12. Answer: 2. Rationale: shock is categorized by 4 stages. Stage 1 is characterized by restlessness, increased heart rate, cool and pale skin, and agitation. Stage 2 is characterized by a cardiac output that is less than 4 to 6 liters per minute, systolic blood pressure of less than 100 mm of mercury, decreased urinary output, confusion, and cerebral perfusion pressure that is less than 70 mm of mercury. Stage 3 is characterized by edema, excessively low blood pressure, dysrhythmias, and weak and thready pulses. Stage 4 is characterized as unresponsiveness to vasopressors, profound hypotension, slowed heart rate, and multiple organ failure. Most often, the client will not survive. 13. The nurse is caring for a client hospitalized for heart failure exacerbation and suspects the client may be entering a state of shock. The nurse plans for which intervention as the priority for this client? 1. Administration of dopamine. 2. Administration of whole blood. 3. Administration of intravenous fluids. 4. Administration of packed red blood cells. Answer: 1. Administration of dopamine. 13. Answer: 1. Rationale: the client in this question is likely experiencing cardiogenic shock secondary to heart failure exacerbation. It is important to note that if the shock state is cardiogenic in nature, the infusion of volume-expanding fluids may result in pulmonary edema. Therefore, restoration of cardiac function is the priority for this type of shock. Cardiotonic medications such as digoxin, dopamine, or norepinephrine may be administered to increase cardiac contractility and induce vasoconstriction. Whole blood, intravenous fluids, and packed red blood cells are volume-expanding fluids and may further complicate the client's clinical status, therefore, they should be avoided. 14. Which clinical findings are consistent with sepsis diagnostic criteria? Select all that apply. 1. Urine output 50 milliliters per hour. 2. Hypoactive bowel sounds. 3. Temperature of 102 degrees Fahrenheit 38.9 degrees Celsius. 4. Heart rate of 96 beats per minute. 5. Mean arterial pressure 65 mm Hg6, systolic blood pressure 110 mm of mercury. 14. Answer: 3, 4, 5. 14. Answer: 3, 4, 5. Rationale: sepsis diagnostic criteria with regard to signs and symptoms include the following: fever, temperature higher than 100.9 degrees Fahrenheit, 38.3 degrees Celsius, or hypothermia, core temperature lower than 97 degrees Fahrenheit, 36 degrees Celsius, heart rate above 90 beats per minute, tachypnea, respiratory rate above 22 breaths per minute, Systolic blood pressure, SBP, less than or equal to 100 mm of mercury, or arterial hypotension, SBP below 90 mm of mercury, MAP of less than 70 mm of mercury, or a decrease in SBP of more than 40 mm of mercury, altered mental status, edema, or positive fluid balance, oliguria, ileus, absent bowel sounds, and decreased capillary refill or mottling of skin. Thank you for watching. Don't forget to like, share, and subscribe for more NCLEX practice questions for NORCET and other nursing competitive exams.